Hello, everyone, and welcome to the organotypic models of tissue development and dysregulation. My name is Benjamin Hacker. I am a fourth-year graduate student in Dr. Marjan Rafat's laboratory at Vanderbilt University. And today I'm excited to present my work on co-cultures of mammary organoids and macrophages and how they provide insight into breast cancer recurrence. So to start off with a little bit of background, breast cancer is the most commonly diagnosed form of cancer, with over 250,000 American women estimated to be diagnosed this year. It's also among the most lethal form of cancer. Breast cancers, there's many different phenotypes. Our lab focuses on triple negative breast cancer, which makes up for approximately 12 to 15% of all breast cancer patients. This phenotype is characterized by an aggressive nature, and it also is difficult to treat with targeted treatments because it lacks the overexpression of hormone and HER2 receptors. So typical treatments for triple negative breast cancer patients consist of some combination of chemotherapy, surgery, and radiotherapy. And a majority of triple negative breast cancer patients elect to receive breast conserving therapy, which involves having the tumor removed as opposed to the whole breast tissue in the case of a mastectomy, and the surrounding area treated with ionizing radiation. Usually clinical dose is around 50 gray and given in 2 gray fractions. Now, this works to improve outcomes for many patients. However, there's a significant subset of patients, 1 in 8, some studies have reported it as high as 1 in 5 or 1 in 4 patients with triple negative breast cancer that experience local recurrence after treatment. Now, we don't know a whole lot about this. However, there are a few things that we do know. The first is that a low absolute lymphocyte count after radiotherapy is linked to recurrence. You can see here patients with a low absolute lymphocyte count, that's patients with low white blood cell count, tend to fare much worse, and approximately half of those patients will experience recurrence within a few years after treatment. We've looked a little bit more closely at the impact that ionizing radiation treatment has on tumor or cancer recurrence using immunocompromised mouse models as models of patients with low absolute lymphocyte count. In these models, mice are inoculated with 4T1 tumors, which are a triple negative breast cancer mirroring cell line. These tumors express luciferase, so they can be picked up on bioluminescent measurements. The contralateral fat pad was irradiated to a dose of 20 gray, which is an accepted clinically relevant model of radiation. And 10 days after radiation, it was observed that in mice with low absolute lymphocyte count, there was a statistically significant increase in bioluminescence, indicating that recruitment of tumor cells and circulating tumor cells had been induced by this ionizing radiation damage. Furthermore, different immune cells seem to play key roles, the most prevalent of which are macrophages. This was shown using F480 immunohistochemical stains, where after radiation to CD8 T cell depletion, the number of F480 positive cells is much higher in both the mammary fat pad and the lymph node tissue. Talking a little bit more about macrophages. Macrophages in the literature are typically polarized into either M1 or M2 phenotypes, where M1 macrophages adopt a pro-inflammatory immunogenic phenotype, and M2 macrophages adapt an anti-inflammatory phenotype that is involved in tissue healing as well as reorganization. Now, in the context of the tumor microenvironment, tumor cells have been shown to upregulate various functions of alternatively activated macrophages to help the tumor survive. An example of which including angiogenesis to help the tumors gain access to more nutrients, as well as upregulating immunoregulatory effects to help tumors evade the host immune system. This has also been shown in patient data where in breast cancer patients, patients with tumors that had high M2 macrophage infiltration tended to be more likely to experience metastasis. This has also been shown somewhat in the context of radiotherapy, not in breast cancer, but in head and neck cancer. Patients were patients with tumors, again, with high CD163 expression, tended to be much more likely to have recurrence at the primary site as well. However, the role of M2 macrophages in triple-negative breast cancer local recurrence remains to be unknown. And so we wanted to do some similar experiments to what had been done previously, looking closer at macrophage phenotype. So in this first experiment, we compared an immunocompetent and immunocompromised model by using BALB/c mice. We induced immunocompromised state by injecting with the CD8 T-cell depleting antibody. After depleting CD8 T-cells, we irradiated fat pads to a dose of 20 gray. And then 10 days after irradiation, we examined what sorts of macrophages were infiltrating into that irradiated tissue by using immunohistochemical analysis. So we stained for the Manos marker, CD206, which is an accepted marker of M2 macrophage phenotypes in mouse tissue. So we didn't see much M2 infiltration in the control, but after irradiation and after irradiation of CD8 T-cell depletion, we did see a much higher degree of M2 macrophage infiltration. And this was a statistically significant increase in CD206 counts per field relative to the control. We did a similar set of experiments, but this time we included tumors in the left side of the mouse, and then we irradiated again after letting the tumors grow up until they were palpable, which is a period of about 11 days. Let's start over. We carried out a similar set of experiments, this time in tumor-bearing mice, where mice were inoculated with 50,000 4T1 cells in the left mammary fat pad. We allowed the tumors to grow until they were palpable, which is a period of 11 days. After 11 days of tumor growth, the mice were irradiated in the right mammary fat pad to a dose of 20 gray. 10 days after irradiation, we resected the mammary fat pads for further analysis of macrophage infiltration. In this study, we performed flow cytometry analysis looking at F480 and CD11B positive macrophages, as well as using CD206 again as a marker for M2 macrophages and INOS as a marker of M1 macrophages. And we observed that, again, in the case of radiation, we saw an increase in macrophage infiltration. And then of those infiltrated macrophages, a greater percent of them in the irradiated case did express the CD206 marker, indicating that they have M2-like phenotype. We also observed a higher ratio of M2 to M1 macrophages in irradiated tissue. Both the number of M2 macrophages, but also the ratio of anti-inflammatory to inflammatory macrophages has been shown in patient data to play a key role in patient outcomes. So we wanted to look at this one step further and develop an in vitro model to probe mechanisms of this macrophage-mediated recurrence. We decided to utilize an organoid model. Just a quick background on organoids. Organoids are three-dimensional tissue constructs that can be isolated from normal tissue, tumors, or cell lines. They can be used in a variety of culture conditions, from very, very complex cultures with multiple cell types to just more simple three-dimensional configurations. They can be used for different sorts of studies, including co-culture, drug response, and cell movement kinetics. This is just a very brief overview of just some recent developments made possible by mammary organoids. So in our study, we isolated primary mammary cells from mice. We resected the number 4 and 5 fat pads We irradiated those SPAD pads to a dose of 20 gray ex vivo. After radiation, we did further tissue processing and ultimately isolated mammary organoids. And this is a representative image of what those organoids look like. So after obtaining these organoids, we allowed them to grow for 7 days, and then we initiated co-culture experiments. In these co-culture experiments, we utilized fluorescent raw macrophages as well as fluorescent 4T1 cells. We initiated this co-culture and allowed it to go on for 24 hours, and then after 24 hours, we imaged the organoids to analyze the co-localization of these fluorescent cells with the organoids. So after 24 hours, we observed a significant increase in macrophage co-localization with irradiated organoids relative to the control, and this occurred at multiple plating densities. We also observed a trend indicating that both irradiated organoids co-localize with macrophages and 4T1s in the co-culture with the cancer cells as well. So to conclude my talk, we've seen that in vivo M2 macrophage infiltration increases after radiation and CD8 T cell depletion. We developed in vitro methods of probing mechanisms of triple-negative breast cancer recurrence, and our organoid model with the co-culture recapitulates key in vivo observations. So where do we go from here? We're really interested in expanding this model and further characterizing it, including looking at dose response studies at various ionizing radiation dosages to study organoid behavior after these various doses have been applied. We're also interested in expanding our co-culture studies to include macrophages that are polarized and at biologically relevant M2 to M1 ratios. And finally, taking a look at factors that have been secreted within conditioned media and determining if there are any cytokines that are associated with macrophage-mediated tumor recurrence. I'd like to thank members of my lab, as well as members of the Wilson lab for helping me with some of the cell stream flow experiments, my committee members, as well as my funding sources. With that, I will take any questions that you have. Thank you for your time and attention.